Part 3, Families, Connections, and Feedback. One of the critiques I received from my professor on this presentation or on this final project was the delivering a diagnosis of Down syndrome recommendations. Now, we all know that these are the best practice recommendations and that this is what you're supposed to be doing. So my intention here is not to tell you this is what you should be doing, but let's take a look at it and make sure we've analyzed each of these steps. So results from a prenatal screening should be clearly explained as a risk assessment, not as a positive or negative result. So number 1, clearly explained as a risk assessment. I respectfully request you consider using the word chance if the family flinches at risk. None of us got pregnant and consider the developing fetus to be a risk, right? So we consider them to be a chance she's a girl, not a risk he's a boy. Not talking about it as a positive or negative result. These often confuse, especially patients with lower education levels. Positive means a positive, right? So explaining what's a negative result, what's a false positive, a false negative. There are lots of complications there, but just talking about it in terms of the possibilities, right? So prior to CVS or amnio, discuss all reasons for the prenatal diagnosis. My question is, what is the patient hoping to learn with the CVS or the amnio? Do they already know what their decision would be if they found out for sure that their child is going to have Down syndrome? If they already know that they would terminate, then it seems appropriate to encourage an amnio because you wouldn't want to terminate a non-impacted pregnancy in that case. If the family is on the fence, that's when it really becomes important to discuss the reasons. And then before the test, probably figure out what kind of life they're willing to live. In our family, we say you get what you get and you don't throw a fit. So for us, and that's a little bit tongue-in-cheek, but we had the babies that we wanted to have. We didn't say we want this one, we don't want that one. But that's our culture, our family, and we're not interested in imposing that on other people. So healthcare professionals are most knowledgeable about Down syndrome, should be delivering the news. Most likely an OB and a genetic professional together. My question to you as genetic counselors is, have you ever collaborated with another medical professional to deliver a diagnosis? I have never seen this happen. Is it realistic? Does this even happen anywhere? While it sounds like a lovely idea and that parents could ask all the questions that they want, I've actually found that OBs and genetic professionals don't actually know very much about Down syndrome, and I don't know if it's actually a great recommendation. If in-person visits are not possible, news should be delivered over the phone at a prearranged time. Here is a really important caveat, okay? Always make sure it's a good time to talk. This has happened to families in our community, and I think you should know this. When a patient is in line at Trader Joe's waiting to check out, it is universally a bad time. Just make sure, is this a good time to talk? I have some surprising news, whatever. We have unexpected information, we'd like to make sure it's a good time when are you and your partner together. Just blurting out information over the phone is not a good idea. If it would be, answer the questions. What is Down syndrome and what causes Down syndrome? Let's practice that now. What is Down syndrome? Think about it. What causes the condition? What is it known as in English? And how do we discuss it in Spanish and in Punjabi and in Mandarin? And what are realistic expectations for individuals with Down syndrome in 2018, today? Not what were the reasonable expectations in the year 2000 or in the year 1992 or in the year 1983. There are very different expectations today for life with Down syndrome. Where are your disability frames and what are your disability frames and where do they originate? What do you think about disability? If you are already biased against disability, if you already think disability is simply bad and should be avoided, is this the right profession for you? If you have no experience with disability at all, please consider that and Instead of saying, no, I can't do this, I don't want to talk about disability, go out and meet people. Go talk to real people who have Down syndrome. Go get involved with the Down syndrome community. Get some experience. That won't be all of your prenatal screening questions, of course. What is it, 50% of screening results come back as something other than Down syndrome, approximately. At least that was what Rapp put into her research. Perhaps that has improved or changed in recent times with the NIPS, but it's hard to say. Answer the questions. What are realistic expectations for Down syndrome today? Not in the past, but today. Offer a connection with parent support groups. The California Down Syndrome Advocacy Coalition blog website has links for you. I can show you that website in a little bit. Your 7th recommendation is to use non-directive language. 41% of parents in the survey that CDAC, the California Down Syndrome Advocacy Coalition, distributed felt they were directed and pressured to make a certain decision. In the anecdotal information at the end of the survey, 0 of those pressures were to continue a pregnancy. Let that soak in. Genetic counselors in Markins in 2013 believed they were being non-directive in diagnosis, but I argue that 41% is a fairly high percentage of editorializing. Again, if you have no experience with Down syndrome, find experience. Number 8, offer up-to-date information, materials, or the bibliography. CDAC has links to up-to-date resources for you right on the webpage, and we will happily share those with you. Offer up-to-date information. I've worked really hard to make it as easy for you as possible. There are experts doing excellent, balanced work on this as we speak. Lettercase.org is fantastic. Global Down Syndrome Foundation collaborates with National Down Syndrome Congress to provide a medically accurate and research-based long view. National Down Syndrome Society has materials available free of charge on their website. You can also order them at low cost. There are lots of ways to do this. Make sure it's up to date. Number 9, make follow-up appointments, including specialists, as needed. How a diagnosis is delivered has a lasting impact on a family. Please consider these conversations with your patients. Acceptance of having a child with a disability or congenital condition depends on similar factors as decisions about prenatal screening and testing. Making sure that best practices are followed, that's a start. Consider why raising a child with a disability is feared. I think a lot of people fear the unknown. They fear what they don't know, and they fear their own inadequacy. And so instead of worrying about these fears, it makes a lot of sense to examine them and decide what are you really afraid of? And then consider why a family was desired in the first place. If you wanted to have a family, this is a family. Families who have kids with Down syndrome will tell you time and time again that their family has improved as a result. Their lives have improved in many ways. That doesn't mean that we are unrealistic about coexisting conditions. We know about cardiac surgeries. We know about the increased chances of leukemia. We know about all that stuff. But most of us, I can't speak for everyone, but I know at least in our family, we wouldn't trade our family for anything. It is what makes our universe ours. It makes our family is real and wonderful and complicated and difficult and wonderful and awesome. There are just too many positives to worry about perceived negatives. The California Down Syndrome Advocacy Coalition, which I co-chair, gathers information on prenatal screening to share with professionals about California's prenatal screening landscape. Our organization is a grassroots organization. We're not a 501c3. We just get people together throughout the state to make sure we're addressing issues that are directly related to Down syndrome, which prenatal screening really is. I had the opportunity to present at the California Prenatal Screening Program Directors Meeting last September with our co-chair, Kathleen Small, and we presented on the findings of a survey that we completed together for our organization. So we were looking really at the California Prenatal Screening Program because it is a very specific program and it's used with families that use predominantly Medi-Cal and are low income. If you have insurance through other means, you probably won't need to use the prenatal screening program because probably your screening is covered by your insurance if you're high risk, of course. Now, people who want to get screening and who aren't high risk may use this resource, but you have to go to specific genetic counselors, which we have found to be, at least in the Central Valley, really problematic. The irony of offering the low cost and no cost comprehensive screening to women in poverty is funded by the same system, which would fund many supports and services to those same people through the lifespan. And that irony is not lost on us. Nor is the fact that there's a disproportionate number of people with Down syndrome born into precarious financial settings and often become more precarious and more complicated, at least during the first 5 years of life. So parents say to be balanced. However, what the CDAC results indicate is that we're not quite there yet. These are the things that, or these are the results basically of the survey as far as their experience in the screening conversation with their genetic counselor. Now, most of these conversations were with genetic counselors. We have more data on that, but I didn't want to make this into every single slide was about data. But the overall experience, I think, is really telling. People who had a positive experience in Southern California were only 25% of participants. In Central California, it was 0% of participants. And in Northern California, 31% had a positive experience. So the actual negative experience is really dramatic as well. So 50% of SoCal respondents, and this went by zip code. So Bakersfield is not Southern California, it is Central California. Fresno is Central California. So the SoCal respondents were negative at 50%, Central California was negative at 81%, and negative in Northern California was actually the lowest at 45%. In my real life, I'm a professor of English, and when my students get 50% or 19% as a neutral experience, they're not happy about it, and I don't think we should be happy about this. I mean, we should be going for positive and neutral at 100% of the time. We know that this is not information that people want to hear, so that could account for some of the negative, but that's not what happened with these parents. What parents would like to say to providers are these things, and I think that really is telling for what they heard in these sessions with their genetic counselors. You were dead wrong, and you almost robbed me of the single most amazing person in my life. He is not a burden, and my family is not suffering. That's not a neutral response, right? Another response from a parent. My son is a healthy, lovely, smart boy, and I'm glad I didn't pay attention to your recommendation. Another parent said, you hurt me. You need to be kind. The only good news doesn't have to be that my child won't have Down syndrome. And yet another parent, say congratulations, don't say sorry and make generalizations about Down syndrome. Another said, you were wrong. The image you have in your head of Down syndrome is incorrect and outdated. You are a coward, and it disgusts me that someone with a medical degree would rely on fear tactics to complete his job. That's pretty strong. I think we'd all agree on that. Here's one that I thought was really important. You are giving life-altering information to families. Stop treating genetic disorders as a plague or something to be ashamed of. Spend time educating yourself on real-life families with special needs children. Once I said I wanted to continue the pregnancy, I did not like that I had to keep repeatedly saying I did not want an abortion. You made me think I was making the wrong decision. Here's another. You are a genetic counselor, and you failed miserably at doing your job. You should be ashamed of yourself. Here's another one. These are all from actual parents who actually had these meetings. So I can't make this stuff up. A diagnosis of Down syndrome is not the end of the world. Tell your patient the positives before the negatives. This is still your patient's baby. A DS diagnosis won't take that love away. You were so wrong about my child, and I'm glad I didn't listen to you about terminating my pregnancy. I was in shock trying to process the information, and I felt I immediately had to defend and protect my baby. Those few people in there who had positive experiences said, thank you for your compassion. Thank you. Genetic counselors are invaluable. Thank you for making me aware. Thank you for helping and caring. Thank you for being so supportive. I really appreciate you being such a wonderful person and realizing that our kids are special. I'm grateful for the information you shared. Thank you. I wish more physicians would follow your lead and stick to the facts. I encourage you to be liberal in sharing DSDN and local resources. So those are, a large number of responses. And as you can see, the thank yous are pretty short, but the critiques are pretty long. And what does that really say to us? That those experiences don't last one day. They last a lifetime. And I think we all know that it's much easier to forget a positive thing than to forget a negative one. There are legitimate parental worries in the United States. Okay, these are really important to keep in mind when someone is making a decision and to respond to these worries and concerns appropriately. Some of these are systemic problems that can't be solved by a genetic counseling session, but the worries exist nonetheless. Will my family go bankrupt? Now that we have pre-existing conditions covered in health insurance, there shouldn't be a reason why this could happen. However, with high deductibles and difficulty navigating systems in California, like the regional center system, where it really depends on your zip code, like who's helping and who's not. Some regional centers pay the deductibles for their clients, but you have to ask for it, or it has to be denied, and then you have to fight for it. So if you're really an educated parent who knows how to navigate these systems, things can be very reasonable for you. You may have amazing insurance and it doesn't have copays for habilitative therapies. In California, the payer of last resort for medical and for health and wellness, health and well-being, is the regional center system. There are lots of protections legally in place, but you really do have to know how to navigate that. And that's a whole full-time career. You could spend a lot of time doing that unless you're connected with the right family support organizations and other parents who've already figured this out, which is one of the huge reasons why connecting families to that support early is so important. What about health insurance, or what about insurance coverage for pre-existing conditions? Well, for a lot of us in the Down syndrome community, having our child with Down syndrome became a motivation for advocacy at the legislative level and ensuring that we were fighting to keep pre-existing condition coverage a legal mandate within our country. Some countries have universal health care, and when they have that, there's no need for worrying about your family going bankrupt. Your worries are something else. But in the United States, a lot of our worries are financial. What about adulthood, So this is a really big question that none of us can predict, right? So as I was doing research for this project, I was noticing that most genetic counselors like to focus, let's really focus on the first couple of years. What do the first couple of years look like? But having those parent support systems, family support centers, things like that, so that you can see what adulthood looks like, can really help. What happens when I'm gone? If you are well connected to other family organizations, especially places like Club 21 or Down Syndrome Connection of the Bay Area, or other organizations that are closer to you, if those aren't the closest places to you, you have a community that will bring in speakers that talks about life planning, that talks about special needs trusts and the ABLE Act, and all of these things that happen that can be used to make sure that your loved one, regardless of their independence level, can still be okay and have a wonderful life once you're gone. I feel inadequate. I don't think I can do this. I guarantee you, nobody in this country has gotten pregnant saying, I really hope, well, maybe two people in the country have done this. I really hope this baby has Down syndrome because I know I can do the best job being a mom to a child with Down syndrome in the entire world. Nobody gets pregnant without feeling inadequate, right? Like you don't know what you're capable of until you're in that situation. You don't know what that does. Like you don't know. I didn't know I could be a mom in the way that I'm mom today. I didn't know I could make sure all of my kids were just fine. And I guarantee you, I still feel inadequate. So there's that. I didn't plan on this. Oh, well, honey, none of us planned on this stuff. And that's just kind of how the world works around. If you have the idea, just like in Michael Berube's book, think that you can plan a perfect child, you probably should reevaluate your parenting strategies and your philosophy, because there are no perfect parents and there are no perfect children. We are humans, and we do this one step at a time, one day at a time, one 12-hour shift at a time when we're in a NICU or in a PICU, and we do it. People do it every single day, and you can too. Parents often express other worries as well, like what about the rest of my family, or what about my other children, and should we have more children? One thing that our genetic counselor said to us was, because our daughter did not have an inherited trait, so it wasn't a translocation, she had non-disjunction trisomy 21, that the chance of having another baby with a similar condition went down to about 1 in 100. And because, that was regardless of maternal age. And she said if we were planning to have more children, we should have more children because that was our plan. And not every plan has to change just because this plan changed a little bit. And I thought that was a really helpful and compassionate way to do this, because our families didn't see it that way. But if you're looking at it from a genetics perspective, that was probably the best thing she could have said to us. Now, as far as the impact on siblings, there have been quite a few studies on the impact on siblings. And between anecdotal and actual research, I have found very few instances of siblings who did not just thrive and have more compassion and had more empathy over the lifespan. Now, that doesn't mean that they're not going to have sibling rivalry or any of the regular stuff that kids do. My kids they're a mess. They're a beautiful, chaotic, gorgeous, imperfect mess. And they are better together than I could ever imagine them apart. And that goes for all of them. It's not like the ones without trisomy 21 are giving so much to their poor, suffering sister. No, they give each other a lot. So we have a sandwich. We have our boy, a 46er first, we have a 47er second, and we have a 46er third. Two boys sandwiching a girl. And I can't even imagine them without each other. They are a team. They play beautifully together, and then they don't. They communicate with each other. And my oldest knows what his sister is saying almost 100% of the time. And often he will, Mom, she said, blah, 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 blah. Why don't you understand her? I'm like, he's just the coolest big brother. And the little one learns so much from his big sister that she'll sit for hours and read him books and play, and they play together, and then they play apart, and they're complete, and they aren't lacking. They aren't sad. They don't love that we have lots of things that are related to Down syndrome on lots of weekends because, they'd rather go to Legoland. Okay, it's fair critique. I get that. But we're not going to Legoland that weekend anyway, so yeah, get over it. They're better together, and I wouldn't wish them any other way. So I have a few requests of genetic counselors, so please take these to heart and let me know what you think. Help patients consider the purpose of the screening and subsequent testing. If they know what they already want to do, that really changes things. If they are looking for answers, please recommend local organizations and those book lists that are coming up next. Use person-first language with Down syndrome all the time. All the time. The reason you need to do this is you are shaping the way people think about their children. And if they see their children as a diagnosis first, that changes the way they do life. Please consider this request. Read and share the reading list on the next slide. Share the CDAC blog with your patients or parents or anyone who you think might benefit from it. Find out what family resources and supports exist wherever you land. Regardless of where you are, there is something around. A lot of people will say that, oh, we don't have anything where we are, but they don't necessarily know how to start to look. There's also a really amazing online resource called Down Syndrome Diagnosis Network. And that online resource is often a great place for people to start. They start with prenatal diagnosis. I think they might even start with screening, so even if you don't have a diagnosis. And they'll put up to 100 women into a birth group. And then they also have supports for dads, and they have like separate dads groups. And those are really helpful. Those groups are monitored. They're always looking for ways to improve that, and they're a really strong nonprofit. I would highly recommend, if you just need information, contacting them because that's what they do. It's their whole purpose and their whole mission is to support families with layers of support in all aspects of Down syndrome, to make sure every family receiving a diagnosis gets up-to-date and accurate information. Right, so here's that reading list. I just have a screenshot here of the first page of my research references. I have 2 more pages and possibly an additional coming. So I'm just going to keep adding to this as time goes on, even though it was a project for this class, because then I can share it with others. I'll likely also put it on the California Down Syndrome Advocacy website, so you can access it there, or you can email me and I'd be happy to send it to you. Books for families, I think, that are really helpful, especially if they are families looking for just a different perspective. If you're looking for memoir, are Michael Berube's Life as We Know It, and then Amy Silverman's My Heart Can't Even Believe It. Both of them are just exceptional. There's nothing else out there like that. If you're looking for someone who really wants a balanced, information-based memoir, like really a thoughtful and thinking kind of memoir. Now there are lots of other like spiritual, religious, all kinds of other memoirs out there. Those don't actually speak to me very, very effectively. But that doesn't mean they don't for somebody else. And I can add those to a reference page, like any memoir that's out there, and just tell you which ones I like best. I'm a research person. I don't care for the other stuff, but everyone's different. And so this is a picture of our Advocacy Coalition's website. It's just a free WordPress, cdacblog.wordpress.com, because we are resource for families. We have resources for prenatal diagnosis, and then over here we see the local orgs and other resources. Right now it's an alphabetized list of everything that's out there, and then we also have local organizations in California. If you're looking for organizations in other states, I highly recommend contacting Down Syndrome Diagnosis Network. They maintain a really solid list of every resource that exists nationwide. and they've got people who are really dedicated to ensuring that families receive layers of support and have as much support as they feel they need. So I highly recommend them as a it's just a really cool organization. Here is my contact information, kellykulzer@gmail.com. So these are all resources for families. You can contact any of them in order to get more information, but also make sure that you're looking for whatever's closest to you and closest for families. Thank you so much for listening to my three-part mini-series on other perspectives on Down syndrome prenatal screening and the diagnosis and conversation process with families.